Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi taala wabarakatuh. We are from KAB Group. We're instructed by our beautiful lecturer, Dr. Rizky, to make a presentation on the subject of psychological testing and assessment in counseling, ABA 3173. So this is our group members. The first one is Nur AMIERAH Shahidah binti Mat ZAHIT. Next is FATIN SHAZWEEN binti JAIMAN. The third is SITI Nur Aisah binti Wan Muhammad. And the last one is AUJI FATHIAH binti AHMAD TARMIZI. So the instrument that we have choose is development and validation of a test anxiety inventory for online learning students. So let's start. Okay, so for the introduction, the name of the psychological instrument in this research is Online Test Anxiety Inventory, or as known as Otai, and was developed by Morteza Alibak, Hoshan Talibi, and Hamid Tahir Nashad Dost. The year this scale was developed is 2019. Anxiety is a common emotion when dealing with daily stresses and problems. This type of anxiety is unpleasant, but it may motivate you to work harder and to do a better job. But when these emotions are persistent, excessive, and irrational, and affects a person's ability to function, anxiety becomes a disorder. There are different types of anxiety disorders, including phobias, panic and stress disorders, and obsessive compulsive disorders, as known as OCD.
So we move to the instrument. In this part, we need to know about the collection data, data analysis, and sampling that have been used in the research. In this research, the researcher used 18 items for 157 postgraduate students that consisting 77 males and 80 females. This data was taken using the online test anxiety inventory that known as Otai. The items are scored on a 4-point Likert scale that range from 0, that means never, 1 means sometimes, 2 means most of the times, and 3 means almost usually. The construct of this research was about anxiety. So, the researcher have conducted an interview with some students. So, from the interview, we know that the main issues faced by online students can be divided into 3 categories. The first issue is when using a computer and the internet during exam. The second one is lack of sufficient discussion, communications, and social interaction between student and also between student-teacher. So the last category is the quality of online teaching.
Okay, so for the next part is the question that given to us. Identify how many subdimension of the skill be mentioned by the developer in the online test anxiety inventory or usually known as Otai. There are 3 subdimensions of the scale. First is psychological with 6 items. Second is physiological with 5 items, and online with 7 items. And the next question is identify the numbers of items in the scale. There are 18 items that included in the scale after the confirmatory factor analysis was employed to obtain the goodness of fit index of the model to the data.
Okay, next I will interpret the reliability value of the instrument and the validity of the instrument. So firstly, the reliability of this test shows that online test anxiety inventory or OTAI had a high correlation with the Abul-Ghazimis test anxiety TAI, which was R stands for reliability equals to 0.83. Okay, as we all know that the closer the value of the reliability R equals to 1, it shows that the least the error occur in the instrument. So this shows that this instrument, which is OTAI, had a high value of reliability with the Abul-Ghazimis test anxiety inventory, as it was equals to 0.83, which is closer to 1. Okay, next, I will explain the validity of the instrument. So the researcher had conducted a co-current validity study for its instrument, which is OTAI, and the OTAI had been compared to its validity with the above Gazamese test anxiety inventory. Generally, we know that co-current validity is a measure of how well a particular test correlates with a previously validated measure, which shows that this study uses the co-current validity when it compares the results with the above-Gazamese test anxiety inventory. The second validity of the instrument, the researcher had also used the content validity to evaluate the items for the instrument. At first, the researcher had developed a pool of 38 items, and it was assessed by 9 psychologists and professionals experts from the University of Isfahan, of all of them who had a track record of working in online experts contexts. The final items for a complete version of OTAI was containing 18 item scale compared to the first 38 items, with 3 components named online, psychological, and physiological, after it had been eliminated the redundant and unnecessary items from the experts.
Okay, so for this part, we have provide 3 peer-reviewed journal articles for this instrument. First is online test anxiety and performance of international baccalaureate diploma program students under e-project exams amid COVID-19. In this journal article, they use Otai to measure the test anxiety of IBDP students before their pre-board exams. They mentioned that researchers verified the adequacy and suitability of the instrument by obtaining the face and content validity of the items from a panel of experts. The second is comparing online cognitive behavioral therapy versus online positive psychotherapy, well-being theory on test anxiety of online learning students, which is in this journal article. They use Otai to assess test anxiety of online learning students among 48 postgraduate students who met diagnostic criteria based on the SM5. And the last one is the revised test anxiety online short form scale B-factor modeling. In this journal article, they mentioned that the OTAI promising validity and reliability evidence for the construct in online testing environments.
So we move to the last part, which is conclusion. Based on this study, we can conclude that the researchers are using OTAI as an instrument to measure a person's level of anxiety as well as the cause of a thing among online students. This study administered to a sample of 157 postgraduate online students, which are from 77 males and active females, aged 22 to 51 years. In this research, we can know that anxiety can happen based on 3 factors, which are online, psychological, and physiological. The results of the current study are coherent with the previous one because it shows that the test anxiety is a multi-dimensional construct. The level of anxiety is based on how they react to it. If they see the situation in a good way, it will motivate people to give their best and overcome the situation better, and vice versa. Throughout the decades, psychologists have continued researching the symptomology, causes, and treatments of anxiety, predominantly conducting studies in clinical, experimental designs. In this research, we can see that students who are good at playing with computers get less anxiety because they can adapt with new ways to learn, which is using online platforms. We can learn about new instruments which are Otai and the rest, such as Saracen's test anxiety scale and Spielberger's test anxiety scale and Abolsmith's test anxiety inventories, as known as TAI. If we do not explore these inventories, we do not know they exist and are so useful. It is because This inventory can help many people outside to decrease and measure their level of anxiety. We can disclose to the community about this inventory test so that they can gain more awareness of the importance of mental health care. That's all from us. Thank you.